Start off. My name is John Dorsley, Director of Marketing Engagement at United Way of Greater Toledo. And I'm more so excited to have you all here to learn about 211. And so without further ado, I will pass it to Jill Bungie. She is the Executive Vice President of Community Impact, and she will be telling you all about 211, how we can use it, everything you need to know, and things to look forward to. So without further ado, take it away, Jill.
Thanks, John. Welcome, everyone. Thank you so much for joining us. We're coming off of a really big week of events last week when we celebrated 211 Day on February 11th. We did a version of this presentation for our Community Learning Lab last Friday, so appreciate you folks being able to join us this evening. We'll also send out slides and the recording of this presentation afterward. Feel free to share that with folks, but let's dig in and overview the service. Okay, so 211. 211, many of you probably have some semblance of familiarity with it, has been long in existence in the community, dating back to the 70s when it was first called for help. The 211 is a free confidential service that connects folks with the local resources they need 24/7, 365. In 2025 alone, there were over 16.5 million connections made nationwide, and about 70% of our 211 services are operated or funded in part by United Ways across the country. In summation, 211 is somewhere that people can turn when they don't know where to turn. They can call us and we'll connect them with help. And Ohio is actually one of only 2 states in the country without coverage over all of our 88 counties. And that's largely due to the fact that state level funding is not provided to support the service. So because we don't have that state funding, there are 30 counties across Ohio that lack the full coverage of 211 support. We, in our local Northwest Ohio footprint, our United Way covers Lucas, Wood, and Ottawa counties. We fund in full that program, largely philanthropically, with some additional grant support. And we brought the service back to the area in 2019 after it had been outsourced to Cleveland. They had a wider footprint at that time. We now completely run the service locally here, and we've been able to expand that county footprint. So since that time in 2019, we've expanded to cover Allen, Hardin, and Seneca counties. We most recently added Sandusky County for full coverage. And then we do basic database maintenance and some light coverage in the rest of the counties listed here: Auglaize, Defiance, Fulton, Hancock, Henry Paulding, Putnam, Van Wert, and Williams. So we're covering a significant portion of Northwest Ohio here. So when we think about 211, we think about the population that we're serving. Oftentimes in the United Way world, we are talking about the ALICE population. This means asset limited, income constrained, and employed. So across our state, 39% of households struggle to make ends meet. This includes the population that is below the federal poverty line, and then ALICE raises that limit to include other folks who are living paycheck to paycheck, who may be employed, maybe having some semblance of income, but they're still struggling to meet their basic daily needs. This includes your cashiers, your cleaners, home health aides, childcare providers, many of the services and jobs that we know are so critical to our communities, to our economy. But they are just not able to cover their monthly expenses, let alone have a cushion when a setback may arise in their life or they find themselves in crisis. So, we at United Way are really focused on this population, and 211, the calls that we receive into 211, many of them are coming from families like this. So when we talk about ALICE households, we're often talking about a survival budget for a particular household. That's the minimum cost to live and work in today's economy. It includes housing, childcare, food, transportation, healthcare, technology. We know that's not a luxury any longer. Kids working remotely from school, having internet, people working remotely from home, having a phone, and then a 10% miscellaneous category. So, that's other expenses that come up. This budget is really the basis for determining whether households are above or below that ALICE threshold. And United Ways across the country, Ohio included, and our 3-county footprint included in that as well. We have access to this information. We participate in a large data collection to make sure we're keeping a pulse on what that looks like in our localities. So the ALICE household stability budget, it incorporates the higher costs for maintaining a more financially stable household over time. Like I said, when people hit an emergency, we want people to become more financially stable, to have a cushion so that, a small setback like a car repair or a job loss, there's a little bit of resiliency there for these families. That's kind of the aspirational goal, right? Or if they're saving to buy a home, we want them to be on that upward trajectory, which often many families don't have the luxury of doing. So this calculator is available on the website. There's a ton of really fascinating data about this. If you Google ALICE United Way, lots will come up. There's a lot of granular data across counties across Ohio that you can look at. This is hosted initially, this ALICE concept was derived out of United Way of Northern New Jersey, and they're leading the data efforts with many other states across the country. But this calculator lives on the website of United Way of Northern New Jersey, kind of the ALICE hub. And you can choose your county. You can go in here, choose the number of adults, seniors, and children in the household, and it'll give you your ALICE calculator budget. You may fall into the ALICE population. Someone likely falls into the ALICE population, but it'll do that calculation for you to showcase, what comprises a household survival budget based on average cost of rent, of food, of utilities in your particular location. So for a family, this screenshot here shows a household that has 1 adult and 2 children. For a family, that a survival household budget would be $57,000, just over $57,000 a year. That translates to an hourly wage of $28.87 per hour. We know a lot of supportive service jobs in our areas. Like I mentioned, nursing assistants, for instance, pay $18.28 an hour. That's $10 an hour less than the household survival budget that would be needed for this household with 1 adult and 2 children. So, we get this question a lot when we're thinking about eligibility for different services. Much of that is based on the calculation of the federal poverty guideline. And the federal poverty guideline doesn't go far enough. So that's why we need to include this ALICE population. For those of you, many of you who are working in social services probably have an understanding of this or know a little bit of the background. But it is based on a formula that dates back to the 1960s, which is now quite out of date. It doesn't take into account modern expenses, let alone the surging costs of things like rents and mortgages. Certainly didn't include cell phones or internet. The cost of childcare and transportation has obviously increased. And it's just calculated at such a low rate that it leaves a lot of these ALICE families without support of other supplemental programs like SNAP or Medicaid or free and reduced lunches. Those are the federal poverty guideline is used to determine eligibility for those other federal supports. But it still is leaving people short of, making this household survival budget or being able to, save for something again. So you can see here the relationship between the federal poverty line and ALICE. So in the blue, that's the total annual income that would comprise someone at 100% of the federal poverty line. Next to that is the ALICE threshold that raises that up a little bit, but we know is still inadequate to make sure that families are stable. And you can see this calculated here based on the number of people in each of those households. For 3 people to be in a household, again, just over $57,000 a year is needed to be able to support that family. So, for those in the ALICE population, 211 is really a lifeline in times of need. We did want to share this video as a snippet before we get into some of the more technical components of the service, just to showcase how 211 is being used by some of our partners across the community.
We've had a strong relationship with 211 for many years. It's honestly one of the most trusted resources we rely on. So one story that I can recall happened, it was wet, it was cold. We responded to several calls for 911 about a family that pitched tents out in an alley behind their former residence. This family needed help. So we went up there, we saw that their essential belongings were stored in these tents, coordinated a team approach. We contacted 211, met with the family at a local library, had access to internet. In a short time, we provided them and connected them to emergency shelter, food, and water.
Here at the health department, we use 211 in a variety of ways. What most is our primary use. We are using 211 to connect our clients to services that we don't provide. Having access to 211 means that when people express needs, we can share opportunities for those needs to be addressed.
One of the Family and Children First Council's priorities is emergency housing, especially since there are very limited local resources when a family becomes unhoused. In addition to the standard information collected by 211, resource specialists gather data and extra details for families identified as Ottawa County residents. We can then connect with a team of local organizations that works in real time to help problem solve and support those families.
During COVID, really seeing the value in 211 and having the answer for families when they didn't have anywhere else to turn for some of the challenges that they were facing.
Even I would, in a time of need somebody to really help me find the right resources for my specific needs. And I think United Way is the friend of the community that you can call 211 and have somebody really help you find the resources and what you really need.
One of those situations recently was we had a family who was living in a camper and it was getting very cold. Like we had this cold blast a couple of weeks ago, and we were able to, in literally a matter of just a couple of hours, find them a place to stay for a couple of nights.
To be able to say, you can call 211. There will be somebody on the other line, a live person, to help you, and they'll help you solve these issues or get the help you need. That made us feel less helpless. We had an answer. We had an answer for people thanks to United Way.
The most important thing people should remember about 211 is that it's not just a number. It's a network of trained professionals that are dedicated to connecting our community with critical resources that they need. When people call 211, they're going to get someone on the other end who cares about them, who's interested in helping them at their most critical set of circumstances. And it's going to help them find whatever they need to get back on their feet and begin to address the challenges that they are facing.
Not only do the 211 resource specialists identify needs and connect families and services, they help organize and prioritize needs and creatively problem solve with callers. I call it the 211 shuffle. So if they have a family who calls in who is struggling to pay their rent for the month, they have the critical thinking skills and the training necessary to say, well, I can't find you a resource for your rent this month, so I'm going to connect you with a place who will pay for your diapers and formula so that you can shuffle that money into your rental line item of your family's budget and help cover it that way.
211 equips our whole community to be better by ensuring that a person can access the services that are designed to help them and get them on track to making the improvements that they want to make. Thank you, 211, for all that you do here in Northwest Ohio.
Super. Thanks so much for letting us play that video for you. We're so thankful to have such great partners across our 3-county footprint in Northwest Ohio. Okay, so let's talk about getting connected to 211. Very easy. First thing, you can simply dial 211. We also have a 1-800 number, 1-800-650-HELP, HELP. You can text your zip code to 898-211. And we also have a chat service, or folks can search the database on their own at 211nwo.org. So the power behind our 211 information referral service is this database. So we maintain listings for over 900 agencies and 3,500 programs. These listings of community resources are updated on a regular basis. They include contact information. We capture eligibility guidelines, hours of operation, any documentation that people need to bring with them to be able to receive that service. And you can imagine here, right, instead of Googling and trying to understand this massive network of truly amazing service providers in our community, you can come to one centralized place, and we're ensuring that people are when they show up to arrive to receive that service, they have everything that they need. They're not going to be surprised by being ineligible or not having a social security card. We want to really equip them for success, make sure that that's a whole and complete referral. It is a lot of continuous work. We have full-time people who are dedicated to maintaining this database and touching those records to make sure that they're most up to date. And then we're also capturing new information all the time. Most recently, as an example, around the government shutdown in the fall, when we were working with some providers around SNAP benefits, there were a lot of new emergency food services that were popping up. So we want to make sure that those are captured in the database so that we can provide a really comprehensive referral and get people the help they need immediately. So I'm going to show you here just a quick overview of our website so that you can kind of see a little bit of that functionality and what lives there. Up top is where you can find the information about calling, chatting with our community resource advisors, and clicking through the database, which I'll go through in just a moment. You can also see an overview of our different programs and services. I'll go into these in a little bit more detail here in a moment, but some of them are listed right out here: coordinated entry, Ride United, transportation access, Project Dash, 2-in-1 to You, which is where we do in-person information and referral at the library, and free tax prep, which is in full swing right now as it's the height of tax season. 2-in-1 Counts. I'll also talk about this a little bit more. This is an amazing website that's extremely powerful. We try to refer a lot of people here, not only those who are interested in just observing community needs, but this is live time data that anyone can access publicly at any time. It's great if you are trying to find backup information about if you're writing a grant, if you are trying to advocate to elected officials. And you can queue in your own search. So you can put a customized date, you can search by zip code, county, congressional districts. You can find basically any way to manipulate the data right here. And it'll show you these different taxonomies. So you can see the total number of calls, the total number of requests that we were able to provide, and then you can see the subcategories. So right now, housing and shelter are listed, and then we have the breakdown of what's underneath that: rental assistance, et cetera. And you can see over there on the right too that we have unmet needs listed too, which I'll get into. You can also access these quick guides. We maintain these for our counties to make sure that there's something quick that you can physically hand to someone. So it's the top resources in each county that you can download and print or send to someone. We also have printed collateral materials. So you can find PDF copies in English, Spanish, Haitian Creole, Arabic, and Mandarin Chinese for information about 211. And then you can also click down here if you'd like to request a presentation for us to come speak to, a certain audience. You can request additional physical print materials if you'd like to put those out in the lobby. So lots of ways to get connected and share information about 211. So let's talk a little bit more about the functionality. There are lots of ways, as I said, to engage across 211, either through chat, through text, but many people prefer to speak directly to one of our community resource advisors. So when you call in and speak with one of our CRAs, our community resource advisors, these are people who live locally in our community. They have a very comprehensive understanding of the database and the resources that are available at a particular time. And one thing we talk about a lot is that they're trained to ask the second question and really work through options to improve people's situation. So For example, somebody was seeking rental assistance. This is something that we're encountering right now. Rental assistance is in very high demand and not a lot of supply. There's a lot of those resources are exhausted right now. So if none of the agencies in our database can serve this individual, maybe based on their eligibility, or that service is not available, the CRA is going to ask that second question and say, okay, did someone lose a job recently? Maybe we could connect you to job resources, or can I refer you to a food pantry so you can offset some of those food costs to attribute to your rent this month or your utilities. So we're really trying to have, not just do that surface level assessment, but really try to understand what's happening in the household. I know I talked a little bit about 211 counts. This is just another snapshot. Our service is free, it's anonymous, it's confidential, but we do collect some de-identified data so that we have a better understanding of where needs exist in our community. And the data collected here can really give us a strong understanding, amongst community partners, elected officials, funders, about how and where resources are needed and how they can be best deployed to help people in need. We want to make sure that we're improving the lives of people across our entire area, but we don't want to make decisions on a gut instinct, right? We want the live data that's populated by people who are in need. So this is a really great data source. Again, we do capture some of these subcategories. So we capture zip code information, so you can look at geographic data, a little bit of demographic data as well, regarding like seniors in the household, children in the household, et cetera. If you want additional information about how you can access this data and pull those data requests directly from our database as you're utilizing this public facing platform, please reach out to us. We'd be happy to have that conversation. Okay, so let's talk a little bit about some of our special projects. We have more to offer than just the connection to resources. So in addition to answering calls, we also bring 211 directly out into the community. This 211 to You program has been in existence for several years now. Every Tuesday from 10 a.m. to 2, we are at the main branch of the Toledo-Lucas County Public Library. We held approximately 48 outreach events in 2025, and this really allows people to put a face to the people who are on the phone. It also gives us, a touch point in a very centralized location. There are a lot of folks who utilize the library for free and accessible services who may be in need of additional resources. You can see some photos here. There's a wonderful organization that was in the Toledo Library serving sliding scale lunches and making healthy meals. They unfortunately closed for a time. They've just reopened under the name Eat Well Cafe as of January, but there was a void in places where people could get lunch downtown. So our CRAs, we were able to raise some additional funds, and we were able to actually provide lunch every time we went to the library over the fall and the winter, which was really well received. Sometimes we take hygiene kits. So just really trying to engage folks who are coming up and be able to start that conversation about how we can get them connected. So another major component of our 211 services, particularly because housing is such a high need right now, is coordinated entry. United Way 211 oversees coordinated entry in Lucas County. So that is the connecting point for people to get access to services if they are experiencing homelessness or near homeless. You can imagine same kind of thing here. Instead of calling multiple shelters, trying to coordinate that, trying to understand, these housing vulnerable households, how best to serve them and make sure that they get to a safe place. We centralize all of this through United Way 211. So we do help with direct placement at 4 shelters in Lucas County: La Posada, Family House, Beach House, and St. Paul's Community Center. We also help maintain the waiting list for individuals who are waiting to enter emergency shelter if there are no beds or rooms available. And then we also are consistently keeping touch with families, right? So we're checking in with them at least once every 30 days to understand if their circumstances have changed. The housing space is a very complicated world. much of the, the definitions that come down federally, a lot of funding that's tied up with housing. It really requires a kind of a unified and coordinated system. And so 211 is the answer to that. In 2025, over 6,500 calls were referred to coordinated entry. So this isn't the totality of people who are calling, asking about housing referrals. Of those, over 6,500 were then referred to our dedicated coordinated entry specialist, who is able to help navigate that process, do a full assessment, and then get them into that emergency shelter pipeline. We also provide referrals to shelters that are outside of our system, outside of these 4 shelters that we do those assessments, referrals, and intakes for. Of those, we made an additional 5,800, almost 5,900 referrals to additional shelters outside the coordinated entry system. There's a lot of really strong momentum and energy happening in the housing space right now. So we're anticipating unifying this in 2026 as well, so it's all under one umbrella. Warming centers. So this was also born out of the high need in the housing space right now. In early 2025, so last winter, and again this past December, we partnered with the Toledo-Lucas County Homelessness Board and the City of Toledo to operate Code Blue warming centers during very extreme cold. Many of our shelters are operating at maximum capacity right now, meaning they have no beds full. This is attributed to 2 things. It's hard to get into shelter for folks because of bed availability or specific needs of specific households that shelters might not be able to accommodate. And then it's very hard to find affordable housing right now. So people have a hard time transitioning out to find a more permanent residency to exit shelter. We also had a very tragic loss this past December when a man who was experiencing homelessness froze to death outside. That moment for us, knowing that it was preventable, really underscored how critical these efforts are. This is a tragedy that requires community action. We, of course, rallied immediately. The onset of the cold was earlier than many of these than the typical warming centers or shelters who usually expand during the winter. The cold set in much earlier than usual. So we really ramped up this Code Blue effort between December and January. This is a duplicated number, but we had 434 people who were utilizing warming centers. And then coming into January, low night averages of 59 people a night, up to nearly 80 individuals per night who had, who were not entering into a full emergency shelter to stay there, but they had a safe place to go. They had a meal, restroom access, a point of connection to other resources. So this has been a really successful program, certainly areas of improvement, but making sure that people are safe, and it's a real-time response. We were also able to provide transportation for folks to make sure that they could get to these warming centers that were opened up. Another support of 211 for accessibility are our language access services. We know our community is extremely diverse. English is not everyone's first language. The 211 website itself can be translated into many languages. And if a person is in need of translation services and wants to connect to a CRA, we also have a service called Language Line, where we, the person can indicate that they need a translator, or, if someone from an agency is calling on their behalf, they can indicate that they need a translator. We will then phone in a translator on the line, and they can help navigate that call in nearly any language under the sun. It's very expedient. It works quite well. So we also want our agencies to know that if they also just need help, with translation in navigating services, they can do, we can provide that service if they call into 211. And then, as I showed you, we have those outreach materials that are also translated into 5 different languages. Ride United access, Transportation Access and Project Dash. So these are newer programs. Ride United started in 2021. Project Dash started in 2023. It's a partnership between Lyft and United Way Worldwide. So the Ride United Transportation Access works directly with Lyft to connect people with rides for nearly anything health and human services that you could think of. So this could be transportation to medical appointments, it could be to job training. We've worked with some additional partners. Sorry, just one moment. We've worked with some additional partners to transport them to ESL classes, tax prep appointments. As I said, we have transported folks to warming centers as well. And Project Dash, similar in nature, but this partners with DoorDash to provide delivery service for necessary items, be it food, diapers, personal care, medical supplies. So DoorDashers will actually pick up items supplied by a partnering agency and then deliver directly to the address of the client. Since the beginning of the program, we provided over 7,200 rides through Ride United and 2,200 deliveries through Project Dash. This program is in very high demand. Unfortunately, our resources are limited. So at this time, a cost share is required for participating agencies, but we're always open to partnership. We would love to work with organizations and find creative ways to expand this service. It seems like this is an increasing need. We've had a lot more interest as of late. So if you're interested in learning more about this program or how your clients or organization could utilize this resource, we do have another informational webinar specifically about these two programs on next Tuesday, February 24th at 11 a.m., which we can follow up with some information about. And finally, one of the best things about 211 is our quick response and our flexibility. So 211, serves at the needs of the community, and especially in times of crisis and disaster. These are just some examples of the places that we have been able to provide additional support and service. The Point Place tornado, so we're able to respond after natural disasters. Of course, we did a lot of expansive programming around COVID with vaccine scheduling, direct financial assistance to households, scheduling food pickups for kids who were reliant on free and reduced meals to be able to go pick up lunches. We're a trusted source of information. We're another place where we can disseminate, institutional information and reliable information from folks. We can serve as a coordinating hub, and of course, people can call us, right? I think one of the most powerful things in my time being with the organization was during vaccine schedulings in COVID. Many of our older adults who were kind of first up, they were having difficulty navigating a lot of the pharmacy websites to be able to sign up for the vaccine. And also they wanted to talk to a person. And so our CRAs were able to have conversations with them, make sure that they were able to register for that vaccination appointment. It was just a high touch opportunity for us to kind of put people's minds at ease and really show up with compassion and care and kindness. Okay, so my last section here, I appreciate you hanging with me. I know there's a lot of dense information here, but I do want to talk a little bit about kind of the state of the sector and then look at a little bit of our trend data. So, we capture information in live time from the community about what their needs are. And I know many people across the health and human services space are having a very challenging time. 2025 was exceptionally challenging. We know that there are, federal and state funding reductions left and right. The economy is tough. And, there's a lot of destabilization in longstanding programs that, are straining the capacity of organizations who were already bending over backwards to serve their clients with extremely limited resources. So, we are very aware of this. This does not go unnoticed by us, but we want to talk about the utility and value of 211 in a time when fewer resources are available. And 211 can really, I think, be this engine to convert what we're seeing into action, right? Whether that's through changes to our service, because we see a trend in a particular neighborhood, whether that is through mobilizing people to volunteer, through advocacy, through storytelling, through, to talk to our elected officials about the changes that we're seeing in lifetime. So really important to be able to leverage this in a way that feels meaningful. And we know that 211 has this power because we sit at a different vantage point. When I think about the partners across community that we often talk to, they have their areas of expertise, they have their areas of focus, and we all know we are bombarded 24/7 with so much information. It is hard to make sense of it all. It's hard to analyze it. So 211 is able to kind of paint a little bit of this picture about overarching community trends. So I did just want to go through a little bit of what that looked like over the past year, and then compare that to some 5-year data. So this is no surprise. Our top needs in 2025, housing, food, utility, and transportation. You can see here 23,000 requests for housing assistance, nearly 10,000 for food, 8,000 for utility assistance, and just over 4,000 for transportation. Now you can compare that to the unmet needs. So I know I mentioned these briefly earlier, but when someone calls into 211 and requests a service, we record whether or not a referral was made. So when a referral can't be made to a service, we mark that as an unmet need. And unmet needs could be marked for a number of reasons. One, the resource might not be listed in our database. It could exist. We maybe just don't have record of it. Two, the individual doesn't qualify for the service or maybe has exhausted the use of that service. So, for instance, in the world of utility assistance, if an agency, they'll pay your electric bill, but you can only use that once in a lifetime or once every 2 years. If the caller calls back and has that need again, we would mark that as an unmet need because we're not able to provide that referral due to their ineligibility or based on the fact that they've already taken advantage of that. The third option is that the service simply doesn't exist in our community. One that I can think about that I know we've had before is car repair. That's just it's an unusual thing. Some agencies don't really offer it. So it's something that people have asked for before, and we don't have it listed in our database. So you can see here different variant levels of unmet needs. Housing being the highest. We've seen a lot of requests for rental assistance this year, which I've mentioned, and those resources are very few and far between. Food, in contrast, is a very abundant resource in our community. So only 4.1% of those individuals who are requesting food do we mark as unmet, because we're usually always able to refer to someone, among our amazing emergency food response network. 15.3% in utilities, which I actually think speculatively is a little underinflated. Again, utility assistance is in very high demand right now, and there's not a lot available. And then 30.5% in the transportation category. So we'll look at some data trends over the last several years here. So the blue line up top represents the number of referrals our CRAs provided to individuals who were looking for housing resources. And then the gray line below are those unmet needs. There's obviously a clear upward trend here in the number of housing referrals, our peak year being 2023, when we made 19,578 referrals. However, they've remained consistently high for the past several years. You can see a slight slope down here in 2025. And just a note here on the 2020 and 2021 end, there was a lot of need around housing assistance still during COVID, and we saw, heightened wait lists, but there was also a lot of resources that were available. So a lot of rental assistance dollars came into the community, millions of dollars came into the community for rental assistance. There were eviction moratoriums preventing people from being evicted from their homes. So just interesting to kind of correlate those trend lines, again, with the other things that we know were happening across the community. Our next most requested resource is food. Again, a very high trend line upward with the need for food. The exception here being 2020. So this is a little bit of an anomaly. When the pandemic set in, we actually worked directly with school districts and Connecting Kids to Meals to coordinate pickups for school meals from March through May. So that significantly increased our call volume. Of course, that was a very valid need, but because we also opened up a program, we were then taking a lot of those calls. But you can still see here this trend going upward. It's remained pretty stable over the past year. And then again, that bottom line there is unmet needs, very, very few of those over the years. And here we can see utility assistance, again, a trend line up for both referrals and unmet needs. And this is really an area that we're closely monitoring. A lot of those flexible funds across a lot of organizations due to cuts on a lot of fronts and philanthropy, with also experiencing a lot of hardship and downward trends of giving. A lot of these funds for utility assistance have been exhausted. So our resource team, they update the database regularly. They have no new resources, and this has been corroborated by several other organizations who are just unable to assist clients in a way that they once maybe have been able to. So intuitively, we know, obviously, if someone is struggling to pay their utility bills, they're probably also struggling to pay their rent or their mortgage, or they are having challenges with other basic household expenses. So, again, we're keeping a close eye here. It's been a really tough winter, an especially cold winter. We know utility bills go up in extreme weather. And finally, transportation assistance. So you can see here a massive spike in referrals. We, in 2020 and 2021, those transportation requests were nearly on par with unmet needs. So we didn't have a lot of flexible transportation resources in the database before we launched the Ride United Transportation Assistance Program. So you can see here the number of referrals that we've been able to provide has gone up exponentially, in addition to the unmet needs. And I think here, this is a little bit of word of mouth about this getting out, but at the same token, for both of those programs, we've been partnering with specific agencies who have specific eligibility criteria. So, for instance, we've worked with Pathways Hub to be able to get some of their folks, some of the women that they're serving to their prenatal appointments. And, if someone else called in asking for a ride, those dollars were specifically attributed to that program. They might not have been eligible for that service, and thus it would have been marked as an unmet need. So again, seeing a lot of interest in this program, and we're excited to be able to expand with additional resources. So finally, my last data slide here, just to paint a little bit more context. This is the same data. I just wanted you to be able to see it in comparison to one another. So you can see that in the total number of referrals that we're giving out, so people who are calling in and we're giving them a housing referral, transportation pales in comparison to the number of housing referrals we're providing, with food coming in at a close second. And again, this is the unmet needs. You can see the dramatic rise in housing, and consistently low across several years in the food space. So just a few more slides here. Appreciate you, all of your attention. We have all of this data. It's important to monitor, it's important to analyze, but we want to be able to translate that into action. So I just wanted to walk through a few examples of our response in community based on the observation of this data. No mystery, we have been in the midst of a housing crisis for the past several years. Rising rents have just outpaced wage growth, and more households than ever are really living paycheck to paycheck. Again, harkening back to this Alice concept with increasing cost of living. We've seen wait lists grow for getting into shelter. And people who are nearing homelessness or who have never been, housing vulnerable before, people who are employed and experiencing homelessness. Really, really challenging. A lot of, as I said, great work happening in this space. But this fall, through our coordinated entry program, we were noticing that bottleneck of people being able to exit out of shelter. There was a particular barrier for some of the folks who were trying to find permanent housing, and they had big utility arrearages. So they had past due utility bills. They were unable to pay those. They found themselves in emergency shelter. And then when they were trying to move into their permanent housing, the utility company, even if they were approved to be able to rent the space, they had, their finances lined up. The utility companies were not able to turn on their utilities to connect them at their new location until those bills were reconciled. So United Way was able to leverage a bequest specifically for utility assistance and find these people who were, trying to exit out of shelter and get into permanent housing. And we were able to deploy those dollars specifically to kind of get that bottleneck freed up. So we were able to help 32 families with over $31,000 in backdated utility payments to get them into permanent housing. And also at the same time, that opens up more beds for people who are on that wait list to enter into emergency shelter. Food response. So I alluded to this a little bit. Many of you probably were closely monitoring the federal shutdown. There were a lot of holdups that impacted our local work across the public sector, but a delay in SNAP benefit payments was of particularly major concern here. So you can see this is daily call volume from October 1st to November 30th. You can see this massive spike as we get towards the first of the month when people would typically have had their SNAP cards, their EBT cards reloaded, looking for food resources because they were not going to have those dollars to pay for groceries. The little dips here, those are weekend days where we almost always see our call volume go down over the weekend. But the overall trend here, obviously leading to the first of the month and just after, people looking for food pantries, which we were able to refer. So in addition, the way that we were trying to rise to the occasion was to share information, make sure the community knew that this was happening, had a lot of great collaboration with Lucas County commissioners, City of Toledo, a lot of our food institutions, Area Office on Aging was at the table, a number of agencies, JFS, Health Department, et cetera. So a couple of press conferences were held, and then we also held 2 information sessions, one specifically geared toward food providers. We had over 150 people there. And then we had a general community information session with over 350 people who wanted to help, who wanted to mobilize, volunteer, be up to date on information so that they could accurately let folks know, especially SNAP recipients. The guidance was changing day to day, and of course, we didn't know how long the shutdown was going to last. But that advocacy work, the information we were able to derive from 211, also, helped prompt the City of Toledo and the Lucas County commissioners to provide emergency funding to our large-scale food providers to make sure that the needs were met for people who did not receive their SNAP benefits. And finally, transportation needs. So I talked about this when we were mentioning Code Blue. We've been able to provide rides directly to these warming centers. So this has also been an opportunity for us, when we have such like a tangible resource to be able to improve our community outreach with populations you might not normally think of. So we have had an increasingly close working relationship with Toledo Police Department over the last couple of years. Their officers are regularly encountering individuals who need access to resources. They may be encountering people who are unsheltered. And the only way that they can transport is if they arrest people. And that is not the outcome that they want either. So we've been able to work with them more closely to get people connected to resources, to find non-criminalizing routes to get people help so that they're not, in a pipeline to have to go to jail or to a hospital. So these warming shelters have been really, really helpful for them. they're able to call us directly. We're able to transport right away. And our 211 program manager, really has done a huge lift to bring awareness to 211. And has attended their roll calls so that they know, this is not their normal world, right? They're not in social services day to day, but many of the folks that they encounter need connection to resources. So we've really been pleased with being able to increase our partnership with them, and how supportive they've been of the program. And similarly, this is a comment from one of our CRAs, who similarly has experienced Amtrak and Greyhound employees. Sometimes they have folks who are trying to stay overnight in those spaces, just to seek shelter. And they have to do their duty to have people, exit and find somewhere else to go for the night. But we've been able to take them to warming shelters and transport them right away. And that feels good for our CRAs too, right? Especially in a time when there's fewer resources available, being able to meet someone's need on the phone and say, yep, we can do that. I've got a lift coming for that person, and we'll take care of them and make sure that they get to a safe place. So to wrap up, we know that it's we are, doing everything in our power to make sure that we have resources up to date, that we're supporting, our community providers who are the lifeblood of making sure those in our community are taken care of. But the power of 211 comes from community. And, we welcome your feedback. If you are seeing emerging needs, if you're seeing programs that are changing, if new resources become available, we want to hear from you. We want to hear about your experience with 211, your client's experience with 211. We want to improve this service to be the best that it can possibly be, for everyone in our community. And I want to particularly thank our CRAs for doing, a really, really hard job in literally answering the call 24/7, 365. So in summation, 211 is a connection to available resources. It's a single point of entry. We have a vast knowledge of available resources, and we can connect multiple people and all types of users. And we want to make this data available for the public, to analyze and inform how to best use community resources. Another plug, for United Way, we often have people who are calling in to find out more information about volunteer opportunities. We do have a new volunteer platform, that John is actually heading up. He's done incredible work get that up and running. So it's a place for nonprofit organizations to find volunteers to their opportunities, and for individuals, corporate partners, to go seek those opportunities and be able to provide the gift of their time and talent. Another quick plug, we just released our 2025 impact report, which will soon be available on our website for you to check out. And as I said, February 24th, we have this Ride United program, the Ride United and Project Dash program webinar coming up for more information specifically about that service. I'm so appreciative of you spending time with us on this evening, and I'm happy to answer any questions.